Well, good morning, everyone, or good afternoon, or good evening, whatever the case may be, for this asynchronous webcast. We're delighted that you're joining us today for this presentation on new directions in rehabilitation research. I'm Phil Rumrill. I'm a faculty member in counselor education and director of research and training at the University of Kentucky. Delighted to be here with you all, albeit virtually. And also I'll be tuning in over the telephone here. So I'm not on the video. The gentleman there on the video is my colleague, Dr. Mykal Leslie, assistant professor and coordinator of rehabilitation counseling at Kent State University. Dr. Leslie and I have worked very closely together over the past several years, and we're glad to be here to talk with you about our perspectives on what's new and coming in rehabilitation research from our own perspectives as researchers, educators, and followers of the rehabilitation research industry. We want to thank the folks at Virginia Commonwealth University, specifically the Rehabilitation Research and Training Center on Intellectual and Developmental Disabilities, which is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. Thank the folks at VCU for the opportunity to conduct this webcast. We also want to acknowledge that much of the research we are talking about, at least in terms of our own work, has been sponsored by a grant from the United States Department of Labor. And on the screen, a grant that was awarded to the University of Kentucky. And on the screen, you see all of the information crediting that particular funded project. I'm going to get started here, and then Mykal and I will kind of pass the baton or the slide presentation back and forth. And as always, we'd welcome any questions, comments. Folks at VCU could give you our contact information if you'd like to talk further about any of the things we cover here today. And we're just going to jump right in. So Dr. Leslie, the first slide that's up now should say have to do with purposes of rehabilitation research. And this is just kind of overview information. One of the main purposes is, of course, to understand the experiences, attitudes, values, concerns of people with disabilities, and of course, other stakeholders in the enterprise of employment and inclusion. Another purpose is to develop an expanding professional knowledge base that can serve as the basis for training and continuing education in our field, and also kind of undergirds the identity of rehabilitation counselors and other rehabilitation professionals with a common ownership of information about what is known about the disability experience. Another purpose is to determine what works in professional practice. This would be more of the intervention kinds of studies that we will talk about. I got ahead of myself there and talked about the basis for training and professional for training and continuing education. But essentially, here what we seek to do is have current and up-to-date understanding of what the disability experience is like and how we can develop practices in education, employment, and community participation to help people with disabilities to achieve their goals and participate fully in all aspects of society. Going to the next slide, these we have sort of synthesized as the 5 most widely researched topic areas in our field. We say over the past 25 years, but Mykal, I would venture to say that these would probably be the 5 most widely researched content domains over the past 50 years in our field. And the first of these is psychosocial adjustment to disability. What is the experience of lived experience of disability for people with disabilities, for family members, significant others? Also attitudes toward people with disabilities and response to disability among people who don't have disabilities, among the general public, among employers, among service providers, policymakers, and a wide range, healthcare providers, and a wide range of stakeholders. A lot of research devoted to the roles and functions of professionals who provide services and supports to people with disabilities. This could be teachers, this could be counselors, vocational specialists. But we want to examine what it is that people are doing in field practice and how can those practices maximally meet the needs of people with disabilities. Another area has to do with outcomes experienced by consumers of rehabilitation services and also students if we look at people in the younger age groups. So we look at what are the long-term outcomes and effects of rehabilitation services broadly as time goes on and once services are either discontinued or people move from one period of life to another, what outcomes do they achieve and how might those outcomes be related to the services and supports that we provide in our enterprise of working with folks with disabilities. Characteristics of professionals and how those characteristics influence outcomes in the process. What are the preferences that consumers and students and family members have in terms of the qualities and training and behaviors of people who are providing services. So looking at what professionals do, but what are those characteristics of those professionals that seem to point toward, the very best outcome in our field. So those are the five main content areas that we see have been researched, and those are still ongoing. But we want to talk about within those five domains and within others, what we see as emerging areas of research, both in terms of populations whose needs need to be better understood, in terms of the scientific methods we employ, and then of course with the specific topics that we choose for rehabilitation research. So if we move on to the next slide, some emerging trends in rehabilitation research that we think are worth noting. One is the evidence-based practice movement, a growing interest in applying scientific evaluative principles to determine what interventions and what services and what supports are most effective for target audiences. And so how do we go about making sure that the things we're doing in field practice have an evidentiary base and are demonstrated to be effective? So the whole evidence-based practice movement, and we're starting in our field and medicine and special education and other education broadly, has begun to establish criteria for what makes a practice evidence-based. So we're seeing more and more of that, and we think that's a very positive and good thing in the overall process of transferring scientific knowledge to field practice. Participatory action research, hard to think of this as an emerging issue because it's been around for a long time. This is the process of people with disabilities being involved in research, not just as subjects in research, but as partners in every aspect of the research enterprise, from development of the research questions to formulation of the scientific methods that are used, to selecting instruments and interventions to be studied, helping to evaluate and interpret the results and disseminating results after that. So people with disabilities as integral partners in the rehabilitation research process. Not a new concept, but we're doing this has become even more of a focus as time goes on, and we expect to see this happening. We're also seeing a growing proliferation of people with disabilities, researchers who themselves have disabilities, taking part in the rehabilitation research process. We see this as a very positive thing, and one that really just underscores the authenticity and social validity of research in our field. Interface with medical research and other research that's happening. We see this. You see a lot of rehabilitation research programs now that are of a vocational nature or psychosocial nature, also linking with the very newest and latest developments in medical research, both in terms of prevention of certain kinds of conditions and injuries and illnesses, but also in terms of most effective treatments. And so understanding how we can interface our vocational rehabilitation efforts with the current state of the art in medical science is a very, very important priority in our field. Program evaluation. The evidence-based practice idea is how well does an intervention work for any particular individual who participates in the intervention, but program evaluation is how do the overall programs, agencies, facilities, and policies, how do they work in practice? What is the overall impact of a rehabilitation agency or a service delivery system or a county-based mental health agency or a state vocational rehabilitation agency? And so we see more and more researchers applying scientific methods to helping people who administer services and supports to people with disabilities evaluate the impact of those programs and services at the broadest level. Moving on to the next slide, we have a slide here of consumer populations whose needs we believe need to be studied more thoroughly and therefore need to be better understood. And this is not an exhaustive list. This is just some as a basis for conversation. But these are populations that we feel we need to continue to study carefully and work in partnership with people who have these particular conditions and characteristics. One is veterans who have sustained disabilities. We've got growing numbers of veterans coming back from the Iraq and Afghanistan theaters, coming back with high rates of traumatic brain injuries, post-traumatic stress disorder, and other conditions as well, but needing support, and we need to better understand how to help our soldiers who are returning back from the wars reintegrate into society and resume their careers and maintain healthcare and community participation in the way they choose to. We have here the elderly, people with age-related health conditions. American society is getting older and older, with the baby boom generation continuing to age into and beyond retirement. And so people with age-related health conditions and disabilities are occupying a larger segment of the disability community, and we need to understand what their needs are and how the aging and other developmental processes interface with the disability experience. People with disabilities who are minoritized by virtue of their racial and ethnic identities, becoming a very, very important issue, and intersectionality between disability and other disadvantaging characteristics, a very important area. And so looking at populations of people with disabilities who represent other diversities, a very important and growing area in our field. Injured workers and how they participate in workers' compensation systems. We've had long histories of providing services and supports to injured workers. Not much history, though, of studying the workers' compensation very systematically. There's some reasons for that we'll talk about later, but we need to have a better handle on what happens to people who sustain work-related injuries and how can we help them maximally to get back into the workforce as quickly as possible. People with emerging disabilities, and these are defined in one of our other webcasts as conditions that are either new to medical science or conditions that are increasing in incidence or prevalence within at least one segment of the population. And some of these include soft tissue disorders and primary pain disorders, such as fibromyalgia and others. A strong rise in cases of these primary pain disorders, asthma, and allergies, and things related to immune responses to the environment. We see a tremendous growth in those diagnoses. Multiple chemical sensitivity, the body's inability to handle and process trace amounts of chemical exposure that is usually tolerable by other people, and people, some kind of autoimmune response happens where people relinquish the ability to have exposure to certain chemicals in the environment, and looking at what kinds of environmental triggers there are for this really insidious and very difficult to deal with condition. Autism, autism spectrum disorder. We know that one in 68 children born in 2020 will be diagnosed with an autism spectrum disorder by the age of 18, and 1 out of 40 males. So we're seeing a profusion of autism spectrum disorder diagnoses and larger numbers of children than ever before dealing with this condition, and we need to understand their needs. And there's been a lot of research in this area already, but we see this growing as the growing numbers of children with autism age into employment and career development and what happens in their adult life roles. Diabetes, we talk about the diabetes epidemic in our country. We have more than 30 million people in America who have diabetes. More than 9% of the entire of the populace has some form of diabetes. So we need to really understand the leading cause of death by disease and the leading cause of blindness in our society. And so the needs of people with diabetes need to be much better understood. And this is probably the most prevalent of all the emerging disabilities we have by that same definition. People with rare disorders, a growing collection of people who are affected by conditions that affect less than 5,000 people, but when you add all those conditions up, they affect larger numbers of people, and some unique challenges there that adhere to a condition that is rare and not well understood. People with substance use disorders, addiction patterns. Dr. Leslie has more expertise than I do in this area, but they're changing. We see the opioid epidemic, of course, and certain addictive substances becoming much more prevalent, and finding ways to assertively treat substance use disorders and help people to figure out how to go through recovery and resume healthy and functional lives following their recovery process. Also, the high rate of substance use among people with other disabilities certainly requires us to pay particular attention to the issue of addiction. So addiction has its own disabling condition, but also as a comorbidity with other disabling conditions, very, very important. Survivors of violence, stress disorders, trauma, etc. Another category of folks whose needs need to be much better understood by rehabilitation researchers and service providers. These are just a few of the populations that we're thinking about that need to have a more prominent place on our social policy and research agenda. We'll go on to the next slide. Dr. Leslie, are you still with me?
Sure am.
Okay. And these are some emerging scientific methods and approaches that we see as becoming more common in our business. First of these is qualitative research, borrowed from the field of anthropology and applied. This allows us to gain in-depth inquiry into the cultural and social aspects of disability, to get in-depth information about the actual lived experience of people with disabilities. A great way to identify issues and concerns that can be the subject of broader-based inquiry, but we're seeing a proliferation of qualitative research in our field. We see this as a really positive development. Multivariate outcome analysis. We've seen complex statistical methods such as structural equation modeling, hierarchical linear modeling, path analysis, mediation analysis, allowing us to look at the very complex relationships among variables that lead us to outcomes in the rehabilitation process. So whether someone emerges from the state voc rehab program in competitive employment or not depends on a number of factors, and those factors that lead to those successes, some of those are interrelated as well. So we've developed the ability to look at complex variable relationships, and this has really increased our ability to understand what procedures and practices in our field work the best. Meta-analyses, a way of combining large numbers of existing studies and finding out what patterns and trends exist by comparing effect sizes from several studies in the same content domain. We see this as a growing and burgeoning area of inquiry, and it gives us a much better way to understand the existing literature in a particular area. Web-based surveys, this almost goes without saying. Most surveys are all web-based now at this point, but I would just say the use of technology in conducting research continues to be an ongoing. It was a tool for a long time, and now it has implications for the very design and analytic methods that we use. Data mining from large national databases that we have in our field, the National Longitudinal Transition Study 2, for example, the United States Equal Employment Opportunity Commission's data set regarding Title I of the Americans with Disabilities Act, the RSA 911 database that allows us to look at the case level into services and outcomes in the state VR program, the American Community Survey, United States Census. We have access to a lot of these databases now in electronic forms, so we can look at population level data and find out exactly what's happening at the broadest possible blush. Intervention studies that relate to evidence-based practice, so applying specific procedures to evaluate, and some of these look like old-fashioned experimental design ways of determining whether an intervention is effective or not, and we're seeing more intervention-based studies and randomized clinical trials in our business, and we see this as very productive. We also know that many of the variables in the lives of people with disabilities are not normally distributed, and many of them are categorical or nominal in nature, and when that is the case, the only analysis you can use for those is what is called non-parametric statistics. So for variables that may not be normally distributed or don't have a wide range, we can look at using a non-parametric statistics such as chi-square and other analyses to make sense of some of those data, which are certainly very important, but may not fit into the traditional parametric and inferential statistics paradigms. So those are some of the methods that we see as emerging. And Mykal, I'll turn it over to you now for the first couple of some of the content domains that we see as particularly fertile for future rehabilitation research. Thank you.
Thank you so much, Dr. Rumrill. Again, thanks for having us. It's a pleasure and an opportunity to be here. Just want to talk a little bit more about some of these emerging topics that we have identified in a little bit more detail. So we talked about the populations, we talked about the methods that are being used. And so what are some of these specific topics that we're studying? One thing that we have a very, very concentrated interest in is looking at disability in higher education. I think for all of you, as you observe the trend in higher education over the last 25 years, as we mentioned, but even as Dr. Rumrill mentioned, even the last 50 years, you see that as time has gone on, higher education has become more and more of a standard, not just a thing that the few are going to have the opportunity to go after and achieve, but the masses are entering into higher education across the board. And that, of course, includes people with disabilities who may previously not had access to certain campuses or certain materials that they needed to attend or participate in higher education, or maybe the resources, et cetera. All of those things are becoming slightly more accessible over time, and we're seeing more and more people with disabilities attending higher education. Of course, if you've applied for jobs, you see that higher education is increasingly becoming a mandatory part of the job application process in a lot of different industries. People are requiring bachelor's degrees now in a lot of different industries where previously they might not have. And so in order to compete and participate actively in the labor market, specifically in the United States, if people with disabilities want to be able to do that, they have to, on some levels, be participating in higher education, depending on the industry, of course. So if we look historically, what's interesting is we see the number of students with disabilities has more than quadrupled in higher education since 1978. And so this, again, just statistics backing up what your eyes tell you and what you see kind of happening over time. You can tell that the number of people with disabilities on college campuses is increasing, and the statistics certainly back that up. What we know from the data that we're able to access is that 12% of American college students have documented disabilities. Of course, these are broadly kind of spread across the board. These might be individuals with learning disabilities, it might be individuals with traumatic brain injuries, people with orthopedic or physical disabilities, individuals with developmental and intellectual disabilities are attending higher education at increasing routes. And there are also, new and varied access routes for people with intellectual and developmental disabilities to interface with institutions of higher education. There's more pathways, of course, for individuals that don't just necessarily go straight into a four-year university. Even the access to local community colleges, two-year degrees is increasing. Pathways to be able to transfer two-year degrees to four-year universities, those are opening up as well. So all of those different things have seen an increase across the board in people with disabilities attending institutions of higher education. What we know about employment and results for individuals with disabilities as they finish higher education is sometimes a little disheartening. And so I just want to talk briefly about some of these statistics that we see across the board for individuals that are graduating with disabilities. A college graduate with a disability is 4 to 6 times more likely to be employed than a person with disability who never attended college. So that's telling us that individuals are, again, more and more so needing that college education to be able to participate in the labor market, as I mentioned earlier. What's also true, however, is that a college graduate with a disability is 8 to 12 times more likely to be unemployed than a non-disabled college graduate. So that gap in employment between those with disabilities and those without disabilities, both with degrees from institutions of higher education, is pretty large. 8 to 12 times more likely to be unemployed. So individuals graduating that don't have disability have a much higher chance of attaining employment out of college than those with disabilities. There's several reasons we think that might be. Dr. Rumrill, I don't know if you want to speak to that briefly, just some of the research that's been done recently on some of those theories we have as to why that gap might be so large.
Well, part of it has to do with lack of career preparatory experiences during college. Part of it has to do with differential expectations that parents and teachers and society at large holds for young people with disabilities compared to those, the expectation to work is different for children with disabilities than it is for children without disabilities. So they don't form those pre-career aspirations in the same way. If they're receiving disability benefits in any way, sometimes participating in paid employment can jeopardize their benefits and sometimes their family's income and livelihood. So that becomes an issue. But we've been focusing more and more on what we can do in that transition into college for students with disabilities. And then once they're on campus, what can we do to help prepare them for their careers after graduation? There's no doubt that the career preparatory value of a college degree is different for a student with a disability than it is for a student without a disability. And we need to change that. And we think we can do a lot during the college years to help to equalize those opportunities. And at VCU, they've got a number of programs and interventions in place to do exactly that Dr. Leslie, you and I have been involved with as well. So some really encouraging trends there, but you're absolutely right. It's important to understand the reasons why, the reasons for those disparities, before we can really address them. So those are some of the things we find.
Yeah, thank you so much. And next, kind of going hand in hand, Dr. Rumrill mentioned that transition. We've focused over time on the transition. This is something in the last decade with Eeoc. We've had an increased focus on the transition of individuals in various stages of life, but specifically from high school to college in the work world. And if we have more and more individuals attending higher education, we are also focused on that transition from higher education into the workforce. And so naturally, the next part of the conversation is career development of people with disabilities. What Dr. Rumrill mentioned earlier is we have increasing or emerging trends, specifically increased life expectancies across the board. And so people's career trajectory might actually be extended a little bit longer than usual. The economy has changed drastically over time. We're not necessarily a production manufacturing economy. Some people refer to us as a service economy. I've even heard it said that we live in what's now an assignment-based economy as far as work positions. So it's not necessarily you have one job, you go into it, you stay with the same company for your entire career. Individuals might be working 2, 3, even 4 jobs at one point in time. They might be shifting between different positions, different occupations from day to day. They might need a few different things to try to help make ends meet. So we really do see career development. We have to look at career development through a lens that's a little bit different than maybe we have traditionally. We also see, because of those life expectancies increasing, that people tend to prolong their overall career and also put off retirement, sometimes out of choice, but sometimes and oftentimes out of necessity, given some of the concerns about the continuity and security of things like Social Security and the unfortunate trends in economic downturns that we've had over the last 20 years. We've seen individuals that have not been able to bank on certain things. So we've seen recessions such as the housing recession and the most recent economic recession we saw with COVID that have had impacts on people's retirement plans. The average worker, as I mentioned earlier, kind of that assignment-based economy, career fields 4 times. We have, as Dr. Rumrill mentioned earlier, systemic work disincentives, such as different benefits that individuals might receive might be kind of contraindicative of their work careers and their desire to move certain directions in their career. Again, the impact of the general economy, as I mentioned, the housing market recession in the 2000s, the most recent recession that we experienced with COVID, those all play a drastic impact in people's career development. What we've seen, just to speak from recent history with the COVID-19 outbreak, is that unfortunately people with disabilities tend to be the first individuals that are let go when people need to trim employment numbers, and they tend to be the last people hired back. And so individuals with disabilities experience these economic downturns more significantly, more harshly than some of their non-disabled peers. And so we have to take that into account when we look at and study the career development of people with disabilities. We also still have a rehabilitation system that is mostly closure oriented. And we mentioned this a few times throughout this presentation, but it's this idea that we are finished. So our work is done in some ways. And I know that kind of conceptually, we probably don't all think of it that way, but that's really how the system works, is once we have somebody in an employment placement, for example, the state federal VR system, we have our status 26 closure after 90 days of competitive integrative employment. And then, we move forward and there's not those ongoing supports. And unfortunately, what we found over time is that a lot of specific disability categories and just people with disabilities in general could really benefit from that long-term support. And unfortunately, if they don't get that, sometimes it ends up being kind of a revolving door system where people are open and closed, open and closed, open and closed. And so what can we do, or how can we target research to figure out how we can adapt or modify or evolve the system to try to fix some of the, or even maybe not necessarily fix, but improve upon the way that we've done things traditionally. And lastly, we don't just want to look at jobs, higher education. We want to consider the full community participation of individuals with disabilities in their communities. That includes independent living and housing. That includes access to transportation. Obviously, in some areas, I can speak from my own personal experience. You know, I've never lived in an area that has great public transportation. And as I've worked with individuals in those areas in the VR system, they've consistently had issues accessing public transportation. And if they did have access to transportation, sometimes it can be a pretty large barrier. It can take hours to get where they need to go on public transportation, even if it's really not that great a distance to where they're traveling. And so as time progresses, how do we address some of those issues, specifically transportation and access to transportation? There's been some creative thoughts as things such as like Uber and Lyft have grown increasingly popular. How do we interface with those things and try to take advantage of the changing economic transportation kind of industry and try to utilize that to the benefit of individuals with disabilities? Access to healthcare. The changing landscape of healthcare is, especially even over the last decade, how those things have changed. I know Dr. Rumrill is going to briefly talk about some of the legal aspects of that later, but just specifically looking at access to healthcare. Again, we mentioned intersectionality, poverty, minority status, individuals with disabilities having issues, not only because of their disability status, but some of their other intersecting characteristics that might create barriers to them accessing healthcare. Legal assistance, again, receiving the needed legal assistance they need, making sure that they're aware of their own rights from a legal perspective and aware of the resources available to them for legal representation and assistance through navigating some of these laws. A lot of them, you know, even those of us in the field that spend hours and hours and hours reading about and researching, we still don't have a full grasp on the implications of all of the different legal documents that impact people with disabilities. And so it would be really hard to expect somebody to be able to navigate that, certainly from an individual perspective. So having assistance, having resources available to them. Participation in the political process. This was especially apparent in the most recent election. Just how we can help individuals access polls. Not all polls have been totally accessible over time. Again, there's been a movement to try to improve that. Having an ability to vote by mail has been really important for a lot of individuals with disabilities who might not be able to access physical poll locations or might have trouble standing in lines for long periods of time. All of those barriers that have been present for a kind of across history that have prevented people with disabilities from understanding their ability to participate and being able to physically access the political process has been certainly something that we need to continue to improve upon. Leisure and recreation, always important to be able to be a fully functioning member of your community, participate in those social engagement activities. The impact on individuals' well-being and mental health is obviously I would say unquantifiable in some ways. So being able to access those opportunities. And again, you get intersections from housing and transportation mixed in there as well. And then lastly, the intersectionality of COVID-19, especially for those individuals with disabilities that belong to more at-risk populations that have been identified. Some people with disabilities are more at risk to contract COVID-19, and some have been more at risk of severe illness if they do contract COVID-19 because of certain disability statuses. And so understanding that they have maybe had to isolate from family members, from friends, have had to worry about whether people that maybe are working for them or are isolating. I know that individuals that that I've spoken with who have access to home care are sometimes worried about whether their nurses or the individuals that are helping come into the home and provide services for them are also taking care of their own situation to where they're not exposing them to any unnecessary risk. And so it's really been an anxiety-provoking time for a lot of people with disabilities, and their ability to participate in the community has been extremely restricted over these times, and the impact of that on mental health, on physical health, is probably something that we need to continue to keep an eye on and continue to research over time. And Dr. Rumrill, I'm going to hand it back to you for the interface between clinical practice and technology here.
Sorry about that. I unmuted and then muted again. Sorry. Interface with field practice, with technology, and of course with the world of work. And this is, never been more prominent a concern than it is and has been during the COVID-19 pandemic. And Dr. Leslie very eloquently, summed up some of the issues facing people with disabilities during COVID-19. I won't restate those, but the issue of technology as a solution to some of the circumstances during COVID-19, is certainly an important thing, and that will be also true going forward in the post-COVID era. But it has also brought to mind the technology gap that faces people with disabilities and the difficulties that they often have in accessing both assistive and general use technology. So we'll bear that in mind as we go through these. One technology issue is the proliferation of online graduate training in rehabilitation and other intervention fields, and also online training in general. This is just becoming physical attendance is going to be optional, I think, for this year in colleges and universities, and probably in the foregoing. And so it's going to open a lot of opportunities, but also present challenges in the way of accessibility and how people access training. Use of the internet as a job placement tool. We're already there with this in so many ways, and so much of what happens with job development and placement and making matches between people's skills and available jobs happens online resources, et cetera. We have to continue to systematically study how technology is being used to help advance employment opportunities for people with disabilities, including home-based employment as a solution to transportation or social distancing requirements, whatever it might be. So the whole idea of working from home and telecommuting is going to be even more important going forward because it came as of such a necessity since last February or so. Impact of social media and networking sites. We're just beginning to scratch the surface of how that works in the way of people making connections, in the way of people making job contacts, et cetera. But just the impact and use of social media and how that affects people with disabilities and in various ways. Does it allow them to be connected? Does it sometimes prohibit them from connecting in person? Once society reopens, there's a whole bunch of things we need to find out about what's happening with use of the internet and social media and how that applies to the disability experience in various ways. Accessibility of online application forms, but how about web-based materials in general? From that standpoint, a number of websites and services to make sure that web accessibility is an important premium, and we need to continue finding ways to make sure that everybody has access to the technologies that they need and to the internet. Access to assistive technology to support people's needs in a variety of ways. This would also, the online access would include like telehealth platforms, ways of getting information and managing one's affairs. So the whole explosion of technology that has been really, I think, ramped up during the pandemic is going to have long-term implications. I think many of them are very positive, and we need to find out what those are and study them very systematically. And then, of course, related to technology, reasonable accommodations in the workplace, both for on-site work and home-based employment. And we're thinking of our colleagues at the Job Accommodation Network, which is a great resource and repository for information on accommodating people in the performance of essential job functions. So a lot of resources are available, and we need to continue to make sure that people are receiving accommodations that they need to do the job, the jobs they're hired to do. The next slide, another kind of growing area is looking at the real and sometimes collective impact of state and federal laws that provide protection, support, services, and other provisions for people with disabilities. The Americans with Disabilities Act Amendments Act, for example, the Workforce Innovation and Opportunity Act, which serves as the current amendments to and reauthorization of the Rehabilitation Act and drives policies in the state federal vocational rehabilitation program, the Family and Medical Leave Act, Health Insurance Portability and Accountability Act, HIPAA, COBRA provisions for people leaving work, the Affordable Care Act, of course, state workers' compensation laws, Social Security, the Social Security Administration's disability policies and programs, benefits to people with disabilities in the Internal Revenue Code, fair labor standards in each state and federal, and a wide range of these laws. So we need to continue conducting policy analyses to make sure that these laws are having their intended effects. And when they aren't, what can we do about that, whether that's changes to regulations, as happens often, or legislative changes, or preparing people with disabilities to avail themselves of those protections, people with disabilities and disability and their advocates and other stakeholders as well. So the whole notion of policy and legal research that and how those laws, not looking at them in isolation, but how they relate to one another, we see as this has been a big part of our business for a long time, and it's going to continue to be, because laws continue to change and evolve, and so too does our understanding need to do that in step. Dr. Leslie, that concludes that slide.
Yeah.
We'll take it back to you for the next few, and you can take us home.
Sure, great, thank you so much. Dr. Rumrill mentioned earlier the National EEOC ADA Research Project, or NIDILRR. That's a project that both Dr. Rumrill and I have had the pleasure and opportunity to work on. We've looked at, through this federal database, every allegation of workplace discrimination made by individuals with disabilities in the United States workforce since the passage of the Americans with Disabilities Act. Again, that's under Title I, which is the employment title of the Americans with Disabilities Act, since 1992. Through this research project, we've uncovered a lot of different insights about the nature of workplace discrimination and the experience of workplace discrimination for Americans with disabilities. What we found has been that there's been over 1 million Title I allegations of workplace discrimination made by Americans with disabilities since 1992. Again, as Dr. Rumrill mentioned earlier, this is what we call population level data. So we really don't have to look any further than just the descriptive statistics to draw conclusions, because there is no real generalizability. The data just is what it is. What we've known is somewhere in the neighborhood of 20% of these allegations are resolved in the charging party's favor. The charging party here being the individual with the disability that is making the allegation of workplace discrimination to the employer or the union or whatever the respondent in this case would be. So what that means is, for every 5 cases that are made, only one of those does the EEOC determine has merit. What we say merit means they would rule in their favor. There's a variety of different ways that happens, but generally speaking, we kind of lump those together and say either the EEOC says discrimination has occurred or it has not. And unfortunately, 4 out of 5 times, or 80% of the time, they're saying that it has not occurred when these individuals are making these allegations. The disability type is probably the most sensitive indicator of workplace discrimination. And so as we look through this, we see that the nature of workplace discrimination varies pretty substantially based on what type of disability the person has when they make these allegations. So for example, somebody with a substance use disorder, their experience of workplace discrimination might differ pretty substantially from someone who might have a hearing loss or visual loss, a sensory disability. What we have found that might be interesting is only 5% of the total complaints in the database have to do with hiring. There are 42 different issues that the database recognizes kind of across the board. These things are like reasonable accommodation, discharge, hiring, constructive discharge, union representation, benefits, kind of all across the board, from very large ticket items to smaller ticket items, promotion, things that maybe don't occur as often but still can have quite the impact. Unlawful discharge is consistently one of the most the most prevalent allegations that get brought to the attention of the EEOC. 35% of all these allegations are made on the basis of unlawful discharge. The next most frequent being reasonable accommodations. So individuals, 18% of all of these allegations are individuals saying that they're not receiving the accommodations that they need to be able to complete their job. So what we know is over half of the allegations that get filed under Title I of the ADA either have to do with somebody feeling like they got unlawfully fired, or somebody feeling like they haven't been given what they need to do their job appropriately and correctly. 9% of the database for each of these categories in harassment, intimidation. So people experiencing on-the-job harassment or feeling like they've been intimidated by their employers or their coworkers. And also the terms and conditions of employment. They feel they're being unfair or not met by their employer. 40% of Americans with disabilities have reported that they feel like they've been discriminated against in the workplace. And so there's a lot of individuals with disabilities who are experiencing this, and that can be pretty substantial, the power differential between somebody who maybe holds your well-being, your insurance, your access to healthcare, your benefits, your retirement, all above, feeling discriminated in that scenario or in that situation can really have a strong impact on individuals' mental health and overall well-being. And so this is something we think is really important to take a look at and to continue to research over time. We also wanted to mention expanding assessments of consumer outcomes. So we need to continue to change the way that we judge or we try to indicate if things are working or not and how people are doing. So continuing to kind of expand the way that we assess and we measure outcomes. I mentioned earlier the closure-based system. So how do we go beyond that status 26 of that successful closure to the long-term impact on individuals' career and individuals' well-being and individuals' community inclusion, independent living, those type of things. We need to continually kind of double down and look at quality of life and life satisfaction, because that tells us a lot about an individual's experience. Who are we to say that just because they get this job in competitive integrated employment or they have this apartment that we maybe wanted them to have, that's improving their quality of life? Let's go to those individuals and ask them what their experience has been and if it's been a positive experience or not. Whether that has to do with work, community inclusion, independent living, kind of across the board. What is their overall quality of life and life satisfaction, and how can we make that better? How can we improve that? So again, the data and the outcome is coming from those individuals' self-report of their own quality of life or life satisfaction, which is important. Workers' compensation outcomes. Again, as Dr. Rumrill mentioned, this is an area where there hasn't necessarily been a lot of quantitative data over time that assesses those things. There's been a lot of kind of trial and error. This is what seems to work. This is what hasn't seemed to work. And so getting the quantitative data to kind of back those traditional practices that we've used in those industries and trying to do some quality improvement and quality assurance over time on how we improve those SSDI and SSI outcomes. So we mentioned that receiving benefits over time tends to be one of the biggest contraindicators for individuals accessing employment. And so how do we look at how to improve those outcomes, how to increasingly enable individuals, if they'd like, to be able to work full-time, and maybe not receive those benefits if that's what they desire, if that's a goal for them. Differential rehabilitation outcomes based on race, gender, and age. So again, looking across the board, not just at overall outcomes, but looking specifically within those areas. We said that there might be some intersectionality or some excess discrimination occurring, and figuring out how different subgroups of the population are doing, not just looking at the whole, because obviously if we look at the statistics as a whole, the majority groups and all of those are going to kind of heavily influence the outcomes. And so we want to make sure that the outcomes are being equivalently divided among the different groups of individuals that we're working with. And there's no one group that are maybe experiencing poor outcomes compared to the rest of the groups. So we want to make sure that from a kind of a social justice perspective, that all individuals are receiving access and services that they need across the board. Also looking at cost benefit studies. We've done this before. This has been a focus that's kind of weaved in and out of rehab research over time, looking at kind of new analyses of what we're doing and how much that we're investing in these different practices and what we're getting out of those. So continually making sure that we're justifying rehabilitation research, not just on the human level, but on the economic level. And we think that there's a lot of economic benefit to what we do. And so we're excited to maybe do some more of these cost benefit studies to show that the value of rehabilitation services to continue to increase the amount of resources we have in the rehabilitation service industry. And lastly, continuing to look at customized and supported employment across time. This has obviously been, some evidence-based practice, specifically supported employment over time, that's shown to be really powerful. Continuing to see how we can apply either customized or supported employment to different populations, different scenarios, and making sure that we're making the best use of these resources and these interventions that have been developed over time. Lastly, before we close here, just briefly talk about private sector research, looking at the validity of life care planning as a rehab service, how effective that is, how important that is to individuals, looking at the cost effectiveness of disability management programs in different industries. This is increasingly important as disability management programs become pretty widely spread. Looking at the progression of benefits, both in short and long-term disability insurance. So kind of keeping an eye on how that changes over time, maybe looking at kind of how people progress through those different systems and accessing those different types of benefits. Different factors within workers' compensation related to return to work. There's been a lot of really promising research that's been done in this area, and we need to increase the depth and the span of that research that we're doing in those areas. And lastly, looking at evidence-based practice and forensic rehabilitation. Forensic rehabilitation is something that unfortunately has kind of been untouched by time. It hasn't changed a lot over the years. And I think that there's some much, if you talk to individuals in the forensic field, they'll tell you that there's kind of some much needed updates and changes that need to be made, but we're not really sure how to get there. So how do we improve the experience of individuals with disabilities that are having to work through that forensic system and update the models and the interventions, if you will, that are being used in that field. Dr. Rumrill, I don't know if you wanted to kind of say anything about forensic or workers' compensation there, because I know this is an area that you spend a great deal of time looking into as we close here.
Nothing in particular. I think you've covered it. I think this is it's a mainstay practice domain, in the field of rehabilitation counseling. It has, but the procedures and practices in proprietary and forensic rehabilitation have not been well studied, partly because of privilege and privacy and things like that, is that people don't necessarily want to open their practices and procedures up to, to other parties to kind of look in on what things are working and what things are most effective. The specific interventions that forensic rehabilitationists, employ are evidence-based, but the overall practice and the overall process, I don't know that we have the greatest handle on that. And so I think that's sort of the next iteration of our understanding in what we call the private sector would be to find a way to understand those, the overall approaches and those things that work best in both the workers' compensation and the forensic rehabilitation sides of the street, if you will.
Yeah, thank you. Well, I'm looking at the time here, and I'm seeing that unfortunately we're out of it. But we wanted to kind of wrap it all around and say that if you have any questions or comments, or if you'd like to have some further discussion about any of these topics on the new directions in rehabilitation research, Dr. Rumrill and I would both be more than happy to chat with you. And so I believe our contact information will be available. Feel free to reach out to us. We really appreciate you taking the time to attend our training and the webcast and to listen to us ramble on a little bit about some of these things that we tend to be really passionate about. We hope that you can take kind of a modicum of growth in one of these areas, or maybe something that sparks your interests and continues to help you grow and dig into the research, or maybe even do your own research in some of these areas as we continue to try to expand and grow the field of rehabilitation research into the future with a mind of these trends that we feel like are really important and impactful to consumers with disabilities across the board.
Thank you all. Stay safe and well.